Hi, Dr. Smith. My name is Emerson Guling, your student nurse practitioner. I'm gonna be I'll gonna be presenting to you a patient that is in the emergency right now, and we're gonna be admitted to your unit. Her name is Betty Vale Stark. Her maiden name is Vale, Betty Vale, but when she got married, she's Betty Stark, but she's referring to herself as Betty Vale right now. So partly there's like confusion over there. She's a 79-year-old female who presented to our emergency department with past medical history of smoking and which is a one pack per day, and she has been smoking for 55 years, and now that a year ago she's diagnosed with COPD and osteoarthritis, and a history of osteoarthritis. Basically, while she was changing her light bulb in her driveway yesterday, she started to become feeling short of breath, and then she was just like taking her albuterol um, pops, a meter dose inhaler, and somehow it did not relieve it. She like took some rest, and then just like overnight, her symptoms become worse. In the emergency, she's diagnosed to have acute respiratory distress, and she reports that she had like fever, cough, chills, and shortness of breath, difficulty of breathing, and which like what I said, the albuterol did not improve it without relief. She also have accompanying signs and symptoms like chest pain, which is she says that is sharp, intermittent chest pain, which is 10/10. Nothing relieves it. She did not take anything. That's why she just like went into the emergency, and somehow that chest pain just went away without taking any medication. The only aggravating factor to her chest pain is that it's worse whenever she's doing some activity and laying down. um yeah with regards to, she has no known drug allergies. Her only medical history is just the COPD and osteoarthritis, and she had like surgical history of tonsillectomy in the past, and pretty much the only pertinent positives for her review of systems is the chest pain, which is located in the middle chest, and which started about an hour or two prior to like coming in. um she still has shortness of breath and difficulty of breathing. When I saw her, she had like coughing, and she said that it started yesterday. She also has like accompanying nausea symptoms, but it is gone right now. With regards to her musculoskeletal, she has a some knee pain, which is worse when waking up, which is uh, you know which is a symptom of her osteoarthritis. Um, all other review systems are negatives, and for her physical examination, her vital signs showed that she has a fever when she came in. Temperature is 102 degrees Fahrenheit, and her pulse is 110. Sinus tachycardia on telemetry. Respirations is 24, and then her blood pressure is 140/80. Um, of course, when she was in the emergency, she was in respiratory distress, gasping for air, and which was relieved with supplemental oxygen. Her saturation when she came in initially with at room air is 92%. At home, she's not using any oxygen. Um, her lungs on oscillation is diminished all throughout. So I ordered for a chest x-ray for this patient, and it showed that she has a right lower lobe consolidation, which is evident and suggestive for pneumonia. ABG was done because of respiratory distress, but it's negative. BNP was done also because she was saying that when she lays down, she is like short of breath, and she had that chest pain, but the BNP is negative. CBC, it showed that her WBC is 11.4 and her CMP is negative. Um, Blood culture times 2 is still pending. I added for a respiratory culture for her, and still it's pending. The lactic acid, because of the temperature, I ordered that, and it said that it's 2.8 AKG, sinus tachycardia, heart rate of 180, no ectopes or anything over there. My differentials is just, because she was doing some activity initially, was rib fracture, which is ruled out already because chest X-ray did not show any fracture on her, on her ribs, and the other differentials that I have is congestive heart failure, wherein her BNP is negative, so we're gonna rule that one out. The only ones left is just the community acquired pneumonia, and community acquired pneumonia and sepsis. Basically, you know, with regards to sepsis, she qualified for the severe sepsis criteria, and because her temperature is 102 degrees Fahrenheit, WBC of 11.4, and heart rate of 110 beats per minute, respiratory rate of 24, and of course the lactic acid that is 2.8, and but she is hemodynamical stable at 140 over 80. To support, to help her with that, differential, my final diagnosis is like severe sepsis together with her community acquired pneumonia. um like what I said, the chest X-ray showed that she has pneumonia. Respiratory cultures are still pending results. So broad spectrum antibiotics was already started. Ceftriaxone 1 gram IV daily, just for coverage, and then as azithromycin 500 milligram IV times 2 doses. But whatever the blood culture and respiratory culture, when the results were gonna come back, then probably we can narrow our antibiotics. um uh, I think not culture. I mean, we're gonna what I meant is pneumonia panel. We'll just order pneumonia panel for this patient. I ordered for ESR and CRP and Procal, just to ascertain if it's bacteria or viral that we're treating, so that it's faster for me to give the antibiotics other than treating viral for this patient. um of course, we're gonna be doing some boluses for her. I already gave 1 liter of NS, and because of her advanced age, the other liter will just be given at 100 per ml per hour, depends. But if she will gonna have some more hypotension, then probably I'll just increase it to 2 liters. If those 2 boluses or 2 liters of NS is done, then we're gonna do another lactate, just to see how she responds. She will gonna be she's already on oxygen, so and our plan for that is just generally to wean her off eventually. What else? With regards to her chest pain, right now her EKG did not show anything. Chest pain, probably will just treat it with Tylenol for now, but I think the chest pain will gonna improve, since I think that's just pleuritic chest pain that is caused by the pneumonia. With regards to her COPD, she was still gonna be getting the albuterol nebulizations, not the meterdose inhaler right now, but just the nebulizations as needed. And then I'm gonna be ordering IS, a cappella flutter, and I already told her that she has to stop and quit smoking. Nicotine patch, I already added that to her to her list of medications. And for her fever, we'll just treat it symptomatically right now until those blood cultures come back. Of course, we're giving her some fluids. Her DVT prophylaxis is, just the 5,000 units of subcutaneous heparin. And what else? If she worsens, then I'm thinking that I'm gonna be calling pulmonary for consultation for this patient. Basically, what we're just like waiting right now is just the pneumonia panel to like come back. If those come back with results, then we can narrow those antibiotics. With regards to her admission, I think she will gonna be better off to be admitted to a telemetry, because her heart rate was 110s, and she was experiencing some chest pain. So yeah, she will gonna I'll gonna like send her to the telemetry. And I think that's all for now. Do you have anything to like add, so I can like add it to this plan of care? Just let me know. Thank you.